known as it's known as the dry drunk syndrome. Next slide, please, Kate. Right. So if we look at what is dry drunk syndrome, this is when people that use substances addictively when we look at people, they use the substances addictively for many, many reasons. Mostly it's genetic predisposition to a substance dependence, which is what we call the sort of biological aspect of the disease of addiction. Then we look at trauma, which forms part of the psychological aspect of addiction. And then also, social conditioning or home environments. A lot of people use substances mainly, if it's for peer pressure, or they've got pressure at school, or, like they're hanging out with the wrong crowd, or, because of their own sort of fears and insecurities, if I can call it that. Those are sort of the three main kind of core aspects of the disease of addiction. Those are the three sort of main reasons why people would use substances. But it is also, it's also the inability to cope with life circumstances. So, for example, they might have stress at work, or sometimes people may struggle to deal with grief, so they turn to substances to deal with that. There's quite, life can be quite challenging, and some people, or people that rather, let me say it rather like this, is that people that suffer with the disease of addiction can't cope with life on life's terms. And that is why, they'll often turn to substances or external factors to try and, solve their problems or make themselves feel better about themselves. So that's where that next point comes in. It's also those negative core beliefs about themselves or their lives. People might feel that, they're a failure, they're not good enough, they don't fit in, there's a lot of different aspects, and obviously this varies on a case-to-case basis. So each person would be individually different. We get people that abuse substances that may not necessarily have experienced any trauma. They might have had a very good upbringing, very good life, been very successful in business, or and not managed to start families and have kids, but they could be affected in other ways. Just in terms of sort of their own emotions or their own thought processes, if I can call it that. Substance abuse may also only be a temporary solution to these problems, and that's the thing is, a lot of people, specifically those that would start because for peer pressure, or just because like a glass of wine at the end of the day makes me feel better when I'm stressed, or I'm just going to go out and have a party with my friends and everything will be fine. What they don't realize is, obviously that kind of causes, they almost kind of feel like, okay, this is quite nice, it feels good, it makes me forget my problems. And that's kind of when the dependency around the substances comes in, is that people feel like, oh, well, this is a nice way to solve my problems, let me just carry on, I'll just carry on doing this as a solution. But like we say, often, with substance abuse, that initial happiness and that initial freedom and that initial kind of feeling of joy becomes overpowered with powerlessness, unmanageability, and obviously the consequences that come with substance abuse. Simply quitting substances without a change in lifestyle or other behaviors and thought processes is just not enough. It doesn't take away the problem the addict or alcoholic was trying to resolve in the first place. So, with dry drunk syndrome, the problem's always going to be there. They're not going to go away. Just because we put the alcohol or the drugs down doesn't mean that they have managed to solve the actual problem that started the substance abuse in the first place. Because when someone becomes addicted to substances, there's always that starting point. Why did they start using? What was the reason? And if they don't look at that and they don't look at their own behavior, nothing really is going to change. If the addiction is not replaced with a healthy pattern of living, they may end up feeling empty, discontent, and full of anguish. And then that's obviously what is called dry drunk syndrome. So when we look at dry drunk syndrome, it's where an addict or alcoholic has no drugs and alcohol, but they also have no solution. So as I mentioned, they haven't actually fixed the problem or the circumstances or the thought processes or the behavior that started that substance abuse in the first place. Next slide, please, Kate. So recovery is not just the abstinence of alcohol or drugs, but it's also known, it's a new way of life. People, they need to complete new lifestyle. They need to complete a new lifestyle to replace what they had. They can be left with the following when only remaining abstinent from substances. So generally someone that just puts down the drugs and alcohol, they are still going to be filled with pain. They are still going to be filled with fear. They may also still have the emptiness that promoted the abuse of substances. Well, the emptiness that promoted the abuse of substances will then could return. That in turn is like, because often when they sort of talk about the emptiness, it's like, when people are feeling lonely or bored, that or kind of feel that something's missing in their life, they'll seek it out. So to give you a good example, someone that's feeling really lonely or feeling like they don't have many friends or decent relationships in their life might seek that out through, going out to parties every weekend or going to the pub every night. If we just take the drugs and alcohol away, that emptiness will still remain because they're not actually working on building up new relationships. And that's kind of that, and I'll cover it later on. It kind of becomes that obsession and that preoccupation of, but when I went out to the pub, it was lekker because I had all my friends there and I had lots of people to talk to and I didn't feel so empty. The individual also ends up suffering through abstinence or they'll return to active addiction. So a lot of the times, like I say, when we're not working on the root cause and we're not fixing the problem or changing the behavior, you're either going to remain incredibly miserable. A lot of the times it's not so much the powerlessness over the substances that's there, but the unmanageability in your life is still there. You're still unable to have healthy relationships with people. You're still unable to kind of keep a straight or clean or regular routine. You're not able to find that balance that you need in life in order to be happy. If we kind of look at the difference between being clean and being sober, there's obviously, there's a lot of aspects that fall under those categories. So clean and sober is not the same thing. So if someone is just clean, that means that they are abstinent from the substances. Often a lot of the times is that person will still be dishonest. They will continue with their addictive behavior. And when we talk about addictive behavior, it's all those character defects that will still come up. So the person is still going to manipulate. They're still going to lie. They're still going to make excuses and justify and rationalize. They might still blame everybody else for their problems in life. They might still be codependent. There's a whole lot of defects that within someone who's addicted to substances, that kind of forms the behavior around it. And those defects were always there just before the substances became a problem. And it's just when you suffer with the disease of addiction, when you have those defects, you don't know how to deal with them. You don't know how to kind of work. So oftentimes, you'll react to situations differently. When you're just being clean, you're still going to interact with people, what we call people, places, and things. So you might have put down the drugs, but the person may still hang out with their old friends. They might still remain in toxic relationships. They might still, hang out at the wrong places. Still go, oh well, and I find that quite common in the younger generation where, they still want to go out and party with their friends. So they might be clean and be go out and say, no, well, I'm not drinking or using anymore. But they're still going to hang around the wrong places. And then when we talk about things, is that they're still going to, keep paraphernalia around. They're still going to kind of like, I always laugh because it's very, very popular to put up posters of dacha plants and things all over the house. Someone who's just clean is still going to have a lot of preoccupation. So they're still going to reminisce about the good times. They're still going to think about how awesome that party was with that friend. They're still going to think about, a lot of the good. They're going to think more about the good times that they have, instead of actually connecting with the consequences and the unmanageability and the powerlessness that came with their substance abuse. Preoccupation kind of also goes hand in hand with that obsession, because what happens is, the preoccupation will start, and then it turns kind of into, it'll turn into like an obsession. And then obviously the people that are sober that are clean will also still be very irritable and very restless. So a lot of the times there's still a lot of depression, anxiety, and all that kind of stuff that comes up in someone that's just being clean. And that's obviously just a result of not working the program accordingly. Next slide, please, Kate. Okay, so when we look at someone who is sober, generally that would mean that someone is working a program of some sort, whether it be, like an anger management program, a recovery program, an outpatient program, an inpatient program. They will be involved or actively involved in a recovery process. And that kind of falls into place with the next point, which is practicing their 5 pillars. When we talk about the 5 pillars, I'll just mention them briefly. Those are things like having a sponsor, going to their NA or AA meetings, continuing with their step work, getting involved in their meetings by getting a service position or doing service for their home group, and then obviously connecting to their higher power on a daily basis. If somebody is sober, the behavior will change. So, if you guys as families and loved ones will be able to see the changed behavior. People will be a lot more responsible. They won't be making excuses, blaming, being dishonest. They'll be taking responsibility. They'll be actively working a program. They won't be so irritable. They won't be so restless. They won't be lashing out or arguing with you every 5 minutes. It also means that when you're sober, you're dealing with your traumas and your circumstances effectively. So either, you might be seeing a trauma counselor, psychologist, or whatever the case is, to be dealing with your trauma. You'll be using your recovery program to deal with your defects of character and the way that you react to situations. You'll be able to handle people and situations, for example, in a workspace a lot more effectively. And then most importantly, being sober is being actively involved in some kind of extended treatment program. Next slide, please, Kate. Cool. So what I'd like to look at now is, how do you know if your loved one is a dry drunk or is suffering from dry drunk syndrome? So what we normally look at is there's quite a few risk factors involved in a dry, like in someone that's having a dry drunk episode, or in an active dry drunk syndrome. I don't know what the word is, process. It will generally start, with social isolation. So the person they wouldn't attend family functions, that kind of hide away from people. It would kind of be the person that just gets up in the morning, goes to work, comes home, isolates in the room, watches TV and goes to bed, makes excuses not to get to family functions, makes excuses not to go out. It's isolation is a big part of it. When we look at someone who's been through a treatment process and been taught about a recovery program, they stop going to their meetings. That's one of the biggest factors. They'll stop seeing their sponsor. Another risk factor is that they have a lack of they feel that they have a lack of emotional support. There's a disengagement from any recovery program, such as 12-step fellowships or any form of extended treatment. So obviously I've touched base on the 12-step sort of factor where, people stop talking to the sponsor, stop going to meetings. but also when we look at extended treatment, so, you know, which is something that I'm very, very, very firm on, you know, with extended treatment, is that, you know, people might spend a couple of months in recovery and just feel like they almost get what we call rehab fatigue, and they get sick and tired of being in treatment. They think that they're cured and they leave. You know, they'll sign themselves out, or they'll manipulate. The worst is they manipulate the family to get out of treatment or extended treatment. They won't be involved, or they'll be very uninvolved in their therapy, where they'll be completely disconnected from their therapist or their sponsor. You know, they just won't want to open up or share their secrets or do anything of that kind. They won't be treating so they might stop treating a co-occurring disorder, anything sort of like mental illness or trauma or anything like that. You know, it's really important that, you know, if someone, a lot of the times with addiction, there's always like an underlying sort of mental issue, or in most cases, there's an underlying sort of issue, such as bipolar, for example. And some people, there's almost a bit of denial around that, and then they'll stop treating that problem as well. You know, like they'll think, because I've been to rehab, I'm cured. That is one of the biggest factors, is that people deny that ongoing need for therapy, or ongoing need for, you know, some kind of program to help them deal with life. It's also, they'll show a lack of healthy coping skills. So, for example, you get into an argument over the dinner table, and your loved one will just lash out and start blaming you for everything. You know, that's when you know that someone isn't necessarily working their program effectively or seeing their therapist, because they're not able to cope or practice any kind of patience or tolerance towards yourself. This is also quite a big one, is if we look at the unaddressed resentments or anger. So generally, you know, there's 12 steps, and normally when they get to about the fourth step, you know, that's where they start looking at resentments and anger, and they start dealing with that and taking responsibility for their behavior. And the thing with resentment is that is kind of the one leading cause to relapse, is that if you don't work through that effectively, you're going to end up just building up this anger and anger, which will leave you, you know, kind of leave you in this very irritable space. There's also, you know, staying in toxic relationships or home environments. You know, sometimes you'll have a loved one that is involved in a very bad relationship. They might have fear around leaving that relationship because they don't want to, you know, they're worried about spending the rest of their life alone, for example. Or, you know, and sometimes in that case, it can be a toxic home situation. It's where people are being, you know, your loved one might be dishonest about cravings or feelings. You know, a lot of the times people that abuse substances or in active addiction, they struggle to ask for help. And one thing that the program of recovery teaches us, and the one thing that, you know, they learn in treatment, is to actually start asking for help and saying, listen, I'm really not feeling okay today. I'm craving, I need help with this. Because the more they talk about those cravings and those feelings, the better it is for them. But when someone is kind of stuck in that dry drunk syndrome, they're not going to ask for the help. And then lastly, it's also engaging in outside behavioral addiction. So it's what I like to call sort of like a cross addiction. So it's usually the stuff that is like involves non-addictive substances, such as gambling, shopping, you know, food could be a problem, relationships, love, sex, all of that kind of stuff. You know, if they're not working on a program of recovery or some kind of treatment, they will, and not working on the root cause of the problem, such as the behavior or the thought processes, they're going to be irritable, restless, and they're going to try and look for something else outside of themselves to make them feel better about themselves. These issues can cause a person to fail. These issues cause a person to fail to address the core issues or the emptiness that fuels and results from active addiction. Next slide, please, Kate. So I think I pretty much covered most of this, but I'm going to run through this anyway and just kind of briefly, you know, explain, you know, some of the ones that haven't come up. Is that, you know, you can look, there are symptoms when it comes to dry drunk syndrome. So some of the signs that your loved one may be suffering from dry drunk syndrome are, obviously we mentioned holding on to that resentment and that anger. Then there's often the feeling of being superior to others. So that person or your loved one might struggle with ego, or there's the other side of it where there's feelings of being inferior or not good enough. A lot of the times, like, someone might go into recovery but just feel like they're constantly getting it wrong all the time, and then they start doubting themselves, and that's what kind of leads to not continuing with the program, and then they end up relapsing. This is a big one, comparing their recovery to others. So, one thing that we teach patients and clients is that it's always about focusing on similarities and not differences. There's so many times where people will come into treatment and they will think that I am not as bad as that person. I didn't do this. I didn't go to jail. I didn't overdose. I only drink alcohol, or I only smoke weed. It's not that bad. It's very, very important for us as therapists, and maybe, the family, just to kind of, it's to encourage them to focus on the similarities and not the differences, because when they're looking at the similarities, we're looking at thought processes, we're looking at behavior, we're looking at certain ways we react to situations, we're looking at fears that we have about, like, that the clients have about themselves, that so that they're able to relate with each other, as opposed to comparing themselves and saying, well, my addiction wasn't that bad, or I'm the biggest gangster on the face of this planet. You can't tell me anything. People that are suffering with dry drunk will also lash out emotionally with outbursts, mood swings, or unrelated, and mood swings and anger that are unrelated to a mood disorder. So, it's not like, it's more of a frustration that people will build up when they're not looking at themselves and they're not working and changing their behavior. So they lash out emotionally. They will engage in compulsive behaviors or non-substance related addictions. Like I explained, that they could move over onto gambling, shopping, food, sex, love, codependency. There's so many other sort of secondary, what we call secondary addictions, which could also be a person's primary, depending on each case. But they'll start engaging in something else outside of themselves to make them feel better about themselves. They will become emotionally or physically abusive. So, like, for example, people that are abusive, the abuse is not going to change if they're not working on themselves and they're not working on the root cause of the problem. Obviously, they're going to lie or manipulate, and they're going to feel empty or unfulfilled. Next slide, please, Kate. So, yeah, again, some of these have been already discussed, but I mean, it's also that I think this first one here is one of the biggest ones, is that isolation from family or friends. When your loved one is not working a program or changing behavior and feeling irritable, restless, and discontent, they're going to not feel like going out and doing anything. So they'll start isolating. And isolation is a massive, massive sign that your loved one may be in trouble. Because it's when that emptiness and that loneliness comes back, and it's one of the bigger causes for relapse. They might engage in high-risk behavior, such as, like we said, the dangerous people, places, and things, hanging out with old friends, getting involved in things that they shouldn't be getting involved in, hanging out in places that they shouldn't be hanging out in. There's a lot of that high risk because they're trying to get that high that they were getting on substances while being abstinent. Your loved one may deny, minimalize, or rationalize their addiction. So, they might, so for example, they'll stop going to meetings, they'll stop speaking to their sponsor. You as a family member might say, hey, what's going on? We noticed you haven't been going to your meetings, and that your loved one is going to make excuses. They are going to deny. They are going to rationalize. No, I'm just so tired after my day at work. It was hectic. I don't feel like going out. I don't want to, my sponsor was busy. Haven't been able to make way or go and see them or like, you know, there's going to be a lot of stuff like that. One of the more popular, more common ones is, you know, someone will get, well, your loved one may get to a year clean and sober and think, no, I've done this I can do this on my own now. I know what to do. I'm fine. I'm cured. But I mean, that could happen at any point in their recovery, because I have people leaving treatment after 20 days saying, oh, I'm cured. It's fine. Again, the fantasizing about the drinking or using will return, and the return of that obsession and that preoccupation of how good life was when I was using. That's also quite dangerous, because that fantasizing makes you forget about the consequences. There's also a display of disproportionate reactions to life events, such as overreacting or not experiencing any emotional reaction to intense experiences. So someone may be incredibly disconnected, or someone may overreact. Sorry, I've just said that one. There's that preoccupation about the good times and forgetting about the consequences. The most obvious one, they'll stop working a 12-step program and stop attending any support groups or therapy. Like I said, you know, they'll either, if they're in extended, if your loved one ends up extending treatment, they might try and manipulate themselves out after a couple of months, because, oh no, I'm fine now, I don't need to be here. So I think it is very common for, you know, like, people to sort of, you know, when we look at addiction, self-will is one of the biggest character defects and biggest parts of active addiction, is that your loved one's always going to think, we can do this on our own. We can try the easier, softer way. We don't need to do extended treatment because 21 days is enough time. I made a year clean. I don't need to keep going to meetings or speaking to my sponsor. So there's a lot of factors that contribute to that. They'll also start struggling to relate to others in recovery. So they might go to a meeting and be like, oh no, that was a terrible share. I don't want to hear that again. Next slide, please, Kate. Lastly, they will develop destructive coping mechanisms such as self-harm. Again, it's that seeking external validation for something that's internally broken. You know, your loved ones in active addiction will often think that something outside of me is going to fix me. There's usually a lot of denial around the fact that I am the problem. I'm the one that needs to change. I think there's also that failure to treat any mental illnesses, which can be physically and emotionally harmful. And then lastly, they refuse to admit to or recognize that their behavior and the impact it has on themselves and others. So again, it boils down to denial and the justifying and the rationalizing and the blaming everybody else except taking that responsibility. Next slide, please, Kate. So how does one overcome dry drunk syndrome? So, you know, there's just a few examples there. You know, the most important one is asking for help. It's about communicating, if not necessarily with your sponsor, but maybe with your loved ones. If not with your loved ones, go to a meeting and share about it at a meeting. So guys, I'm struggling. My life is unmanageable. I don't know what to do. I'm not coping with certain situations. How do I deal with it? Another way is, like, what's quite nice is that you can catch the relapse before it happens. Because, you know, I always say that a relapse will happen before you actually pick up the substance. So these are sort of signs that you can look out for, you know, with your loved ones, and maybe just kind of point out to them that, hey, listen, you know, you don't want to enable, I think it's in the next slide, but you don't want to enable or rescue them, but you want to be supportive and say, like, listen, we noticed you're not going to your meetings. What's up? What's going on? You know, that the person that's sort of suffering from dry drunk syndrome can kind of catch a relapse before it happens by seeking out some kind of treatment or counseling, or oftentimes they might book themselves into treatment to say, like, I'm heading to a relapse, I can see this is coming, I need to get help, and I need professional help. practicing the 5 pillars of recovery on a daily basis is incredibly important. They must keep going to meetings. They must keep seeing their sponsor. They must keep doing step work, because in doing all of that, they're going to change the behavior and the thought processes, which in turn will make them happier. And then obviously look at revisiting their sustainable recovery plan. What am I not doing that's necessary for my recovery? So what happens with our clients here before they leave, we often give them a sustainable recovery strategy. What that includes is like, you know, what are your goals? What are your objectives? What's your recovery plan? How many meetings do you plan on doing? What activities are you looking at taking up? What are you looking at getting rid of? How are you going to deal with certain situations? It comes with, like, I think it's 2 pages of signs that you might be in a dry, drunk, or possible relapse situation, and we often let them take that home. You know, we sit and go through that with them, as you know, from a counseling perspective or therapist perspective. We'll go through that with them, give them suggestions, help them with what they're struggling with, and they actually get to keep that plan. And when they get home, like I always say, you know, kind of review it on a month-to-month basis and see where you're at in your recovery. What do you need to change? What do you need to add? What do you need to take out? That's always a good one to keep with them. Next slide, please, Kate. How do you, I think this is the last one, how to help your loved one when they're dealing with a dry drunk, or you notice that they could be suffering from dry drunk syndrome. You can help them with overcoming this, which could include the following. You know, I always talk about inpatient or outpatient treatment, or extended care is usually quite a nice one, because then they can get, you know, kind of full therapy. Be supportive, be kind, don't rescue or enable your loved one. Their recovery is their responsibility, not yours. So you can be there to support. And also then, you know, it's kind of, you can confront them either with tough love or like an intervention, or any kind of sort of way you feel is necessary to support your loved one. But most importantly, I think it's just trying to keep them in some kind of therapy process or recovery program. You know, I say when people get out of treatment, a recovery or 5-pillar program is compulsory. There's no choice in the matter. That is a must do. They must continue with their 5 pillars. If they can opt for extended treatment, that makes it even better, because it just gives them a lot more of a foundation for when they leave treatment, to get them, you know, a lot stronger in terms of their changing their behavior and their thought processes. Next slide, please, Kate. Yeah, so if we look at in conclusion, dry drunk syndrome is fairly common in early recovery or people who have only experienced treatment once. Addicts run mostly on self-will and believe they can do this on their own. It is important to be supportive and encourage them to seek out help, or let them know that they can communicate with you so that the healing process can begin.